The things that I really enjoyed at this year's EHA were to start with the rebalancing therapies for hemophilia. We know, of course, about the treatments that are working on tissue factor pathway inhibitor or decreasing antithrombin, in which we don't really do something about coagulation. We just change the balance, where in hemophilia patients lack pro-hemostatic proteins, we decrease their anticoagulation proteins, and we end up with a rebalanced hemostasis. Those are things that are going to come to the market. Very interesting. They are marketed for hemophilia, while on the other hand, they would be usable for other hemostatic disorders. And with that in mind, I was happy to see that in a completely other presentation, a researcher presented their hypothesis that if you would decrease plasminogen, you could end up with a treatment that promotes hemostasis. And they said for people with a bleeding disorder of unknown cause, but that would be just as usable as other pro-hemostatic rebalancing drugs for hemophilia. A hypothesis. There were no efficacy data, it was just on safety, but that was very interesting. And then what I always like about EHA is that we have both the coagulation people and the malignant hematologists, so there is a lot of interest in the interface between the both. I've seen very interesting work on predicting bleeding in CAR T-cell therapy, but also a number of presentations on the characteristics of thrombosis in myeloproliferative diseases, and very worrying data about the high incidence of thrombosis in primary CNS lymphoma.